We hope that this presentation will answer some questions and alleviate your concerns in regards to your surgery.
3 to 7 days prior to your scheduled procedure, a PAT nurse will call you. If you receive a telephone message requesting a callback, please do so as soon as possible. The earlier we can obtain your information, the sooner we can address any pertinent issues. During the phone call, the nurse will review all of your health history and all of your medications, both prescription and over-the-counter. You will be instructed on which medications should be held on the day of surgery and which medications can be taken with just a sip of water. Please discontinue any use of NSAIDs, which are non-steroidal anti-inflammatory drugs such as ibuprofen and over-the-counter supplements for 2 weeks prior to surgery, unless otherwise instructed by your surgeon. While reviewing your medical history, our nurses try to be as thorough as possible. However, each individual is different, so if there's any health issue or hospitalization that the nurse did not specifically ask you about, please tell the nurse at the time of the phone interview so we can best prepare for your surgery. The PAT nurse will also provide you with an arrival time on the day of surgery. Please remain flexible, as the times can change up until the night before surgery. If, and only if, there is a change in time, you will be notified the night before between 6 and 7 p.m. Please let the PAT nurse know if there's an alternate number we can reach you at the night before surgery in the event you're staying with a family member or at a hotel. Fresno Surgical Hospital has an obligation to protect your health information. We do this by providing you with a PIN number for your visit. You may give this number to anyone you wish to be updated on your care. Friends and family who contact Fresno Surgical Hospital who do not have the PIN will not receive any information regarding you without it.
In the days and weeks leading up to your surgery, please be protective of your surgical site. Try to avoid scratches, cuts, bug bites, burns, etc. near the site. If something does occur, which compromises the integrity of the skin, please contact your surgeon's office and let them know. Do not shave your surgical site. This could cause a skin rash or small cuts that could be problematic for your surgery. You will be provided with a bottle of chlorhexidine soap, commonly known as Hibiclens. The night before your surgery, you will take a regular shower. During the shower, step away from the running water and using half the bottle, soap your body from the neck down, avoiding your genitals. Allow the soap to stay on your skin for 2 full minutes and then rinse off. Repeat the process in the morning on the day of surgery. After the shower, do not apply any lotion, deodorant, or perfume, etc. You will need to be fasting starting at midnight the night before your surgery. You are to have nothing to eat or drink after midnight. This includes water. Please do not chew gum, breath mints, or hard candy. Brush your teeth in the morning, but do not swallow the water.
Enter the lobby through the main entrance on the south side of the building. Please be sure to bring a photo ID, insurance card, and advance directive if applicable. Also, please remember to bring all of your medications in the original containers with the exception of narcotics and any medical equipment obtained for post-operative use such as a walker, a brace, or a cervical collar. If you use a device for sleep apnea such as CPAP or BiPAP or an oral device, bring those as well. You're welcome to bring your own clothing, pajamas for after surgery, along with whatever toiletries you should need. For your convenience, the hospital has free Wi-Fi available. When you check in, you will be registered, and the pre-op nurse will be notified. She will come and escort you to the pre-op area. The pre-op nurse will review your consents, review your medications in their original bottles that have the pharmacy information on them, take your vital signs, start an IV, and begin to prepare your surgical site. Once the preparations are complete, we do allow a friend or family member to wait with you. While in the pre-op area, you will be visited by your surgeon, anesthesiologist, and OR nurse. This is a good time to ask any last-minute questions.
While in the pre-op area, the OR nurse will interview you and ask you some of the same questions that have already been asked, like your name, date of birth, and which side we are operating on. We know, but we verify again for your safety. We will be sure your consent is signed and review your allergies and medical history. You will be visited by your surgeon, who will mark your surgical site with their initials. You will also receive a visit from your anesthesiologist, who will discuss your options for anesthesia. The anesthesiologist will ask if you or anyone in your family has had problems with anesthesia in the past. You should also let the anesthesiologist know if you've had any problems opening your mouth or extending your neck, or if you've had any surgeries on your neck or back in the past. Remember, nothing to eat or drink after midnight the day of your surgery. If you are told by your physicians or the PAT nurse to take certain meds, do so only with a sip of water. You may notice that the OR is very cold. Two of the reasons for this are bacterial growth is greatly reduced in cold environments, and the OR staff and surgeons wear a lot of garb that can get very warm under all the OR lights, so we like to keep them comfortable. But not to worry, we will be sure to bundle you up with lots of warm blankets if you like. If you and your anesthesiologist have chosen general anesthesia, we will give you a little medication through your IV and off you go to sleep. If spinal anesthesia was the choice, the anesthesiologist will give you some medication in your back, which will numb you from the waist down. Spinal anesthesia is specifically helpful with the total joint because it helps with pain control in the post-operative period. If you are having a total shoulder replacement, you will have general anesthesia with a block to help numb the arm and provide pain control. There is a team of 6 people working specifically on your case and will be with you the entire time. These skilled individuals include your surgeon and his assistant, the anesthesiologist, a scrub tech and circulating nurse, as well as a representative who assists with the prosthetic. Your surgery may last from an hour to 2, and when finished, you will be taken to the recovery room by your OR nurse and your anesthesiologist.
Once in the recovery room, you will be closely monitored by an RN. You can expect to have several monitors attached to your finger and chest. All of these will keep a close eye on your blood pressure, heart rate, and oxygen levels. Depending on your surgeon, you may have a drain coming from your surgical site, which the nurses will tend to. You can expect to be in PACU for 1 to 2 hours while the anesthesia wears off. If you had general anesthesia, your hearing will be the first sense to return, and the room may seem noisy, and OR staff giving report, alarms, and monitors sounding. It can be disorienting, but the nurses will orient up to where you are and how you're doing. It may seem chaotic, but I promise you, it's an organized chaos. If spinal anesthesia was the option best for you, you will likely be more alert to what's going on around you. Your RN will frequently assess your sensation down your legs. Sensation will slowly return as your spinal resolves. During the immediate postoperative period, your nurse will assess and manage any postoperative symptoms such as pain, nausea, or itching. Be sure to let your nurse know if you experience any of these. Medication can be given through your IV to manage these. Pain is most commonly assessed using the numeric pain scale. Pain on a scale of 1 to 3 is considered mild, 4 to 6 is moderate pain, and 7 to 10 is considered severe pain. But we will do our best to manage it adequately so that you are comfortable. For identification and verification for patient safety purposes, we always ask your name and date of birth when you arrive and when giving all medications. Once your vital signs are stable and you have met all the criteria for discharge from the recovery room, we will move you upstairs to your private inpatient room.
The inpatient department here at Fresno Surgical has 27 private rooms to give you privacy during your recovery. You are permitted to have one guest over the age of 18 spend the night with you. We have sofas in the room that pull out into beds at night. They are also welcome to order and eat meals with you. There is a cost for guest meals, which we will give you details on in a later section. You will be brought to your room on a gurney from the recovery room and then be greeted by our friendly and highly knowledgeable staff. The nurses will give report, do an assessment, orient you to your room, and plan for the day. We frequently check your vital signs during these first few hours. Now, once you're settled, your family will be allowed in to visit. There are a few things you may notice that are used to help in your recovery. You can expect to have IV fluids infusing to keep you hydrated. Ice packs will be placed to your operative site to minimize swelling, and depending on your surgeon, you may or may not have a Foley catheter or surgical drain. You may have compression stockings or automatic sequential devices on your lower extremities to help prevent blood clots. If you had general anesthesia, a pain pump may be attached to your IV fluids that will allow you to medicate yourself for pain as needed within the parameters set by your doctor. This is generally not needed if you had a spinal anesthetic. If you have had a knee replacement, you may be started in a CPM, continuous passive motion machine. We will initiate this as ordered by your physician. After anesthesia, some patients do not breathe as deeply as you normally would. Because of this, we will be monitoring your oxygen levels, and some patients require small amounts of oxygen administered through their nose. Your nurse will educate you on how to use and the importance of an incentive spirometer. This device helps to exercise and expand the lungs to help prevent post-operative pneumonia. Nausea and vomiting can commonly occur after anesthesia, which your nurse will be assessing for. For your comfort, your doctor will likely prescribe several medication options to help alleviate this as well as any itching which may occur. Your first meal will be clear liquids. As long as you tolerate that, we will advance your diet to regular food. You may participate in physical therapy on your day of surgery, depending on your physician orders. On post-op day 1, your nurse may change your dressing and assess your incision. You may also have your drains and catheter removed as well. You will have 1 or 2 rounds of therapy, 1 before lunch and 1 after. We can coordinate your therapy around your pain medication schedule as needed. You may change into your own clothes, but we do request that shorts or loose-fitting pants are worn so that we can easily have access to your surgical site. If you had a hip replacement, elastic waistbands are good so we may access your dressing. Short-sleeve shirts are requested so we may have access to your IV site. If a pain pump was necessary, we will take that off and try to get your pain managed with oral pain medications, preferably the medication you had been prescribed at home so we can be sure it will be effective. You may get to go home on post-op day 1, depending on your physician and how well you are progressing. There are 4 conditions of discharge. We need you walking safely with a walker. We need your pain managed with oral pain medication. We need to see your lab levels within normal parameters, and we need you tolerating fluids so that you can remain hydrated at home. If you're here on post-op day 2, you will do at least 1 round of therapy, maybe 2 depending on how you're doing. If you only do 1 round of therapy, you may plan on discharge around 11 a.m. If you do both rounds of therapy, plan for discharge around 2 p.m. Prior to discharge, your nurse will review discharge instructions with you that will include diet, activity, medications, and dressing changes.
Physical therapy's goal is to get you up and moving as safely and quickly as possible. We'll be seeing you either the day of surgery or the morning after. The first thing we'll discuss with you is your discharge plan. We want to know where you're going, who is going to be taking care of you, and what the environment will be like. So please, take a look around your discharge destination before you come to surgery to identify any obstacles. We want to know if you have stairs and what safety concerns you may have and any other questions you might want to ask for a safe discharge. This will help us to plan your treatments. After discussing your plan, we will get started on your exercises. These exercises are designed to help you with strengthening, range of motion, and blood clot prevention. we'll be giving you a handout with all the exercises. It's our expectation that you'll continue to do these exercises at home as part of your home program, and we want to make sure you feel comfortable with them and know what is expected of you. After exercises, we will get up and go for a walk. If we're seeing you day of surgery, it is usually a short walk, just around your room. After that, we will be increasing the distance each time we get up and walk. If you have a walker at home, please put your name on it and bring it with you the day of surgery. The staff here will make sure it arrives in your room, and we will adjust it for your height and make sure it works well. If you do not have a walker, that's okay. Our discharge planning staff will help you get one. If you're a shoulder patient, you will not need a walker, but you may bring a cane if you have one. With our shoulder patients, we will focus on mobility, getting out of bed and walking. You will not be lifting with that arm or putting weight through that shoulder. We will teach you how to take your sling off and on and review any exercises your physician may have prescribed. If you're having knee replacement, you may have a CPM machine while you're here. It will bend and straighten your knee to help with range of motion and pain. We will give you a handout with instructions, teach you how to use the controls, and review your surgeon's instructions. If you're having a hip replacement, you may have what we call hip precautions. This just means that there are certain ways we want you to avoid moving after surgery to help protect the surgical site. This does not apply to all hip patients, only some of them. If this applies to you, we will give you a handout with these instructions. We would like to have a family member or a friend present during PT treatments when possible. This way, they can see what your exercises are, how far you're walking, and we can educate them on how best to help you at home. The idea of getting up and walking after surgery can be intimidating, and we understand that. The reason we do that here is because there have been studies that say the sooner you get up and start moving after surgery, the better the outcome is. And we want you to do well and excel. So we're going to help you get started, but we promise to be safe while doing so. We look forward to working with you.
During your stay, our kitchen staff will work with you to ensure that all of your needs are met. When you receive your pre-admission phone call, please let them know if you have any dietary restrictions, such as lactose intolerance, gluten-free, or any other food allergies. Our chefs have worked hard to come up with a variety of delicious meal options for you to choose from. Dietary staff will come to your room prior to each meal to take your order. At this time, you may place a guest order as well. Pricing for guest meals varies, and we accept all forms of payment. Once your order has been taken, it will be brought down to the kitchen where the chefs will begin to prepare your meal. Once ready, our wait staff will deliver your meal to your room for you to enjoy.
As discharge planners, we want to make sure that you have a safe transition from the hospital to home and that you remain safe once at home. We ask that prior to your surgery, you have a plan. This should include transportation home, a care partner, a place of destination, equipment, and medications. When considering transportation, it's good to know who will be driving you home and in what type of vehicle. If you do not have a ride home, we can arrange private transportation for you. The cost is between $40 and $50, cash or check, and sometimes credit cards are accepted. They do charge at the time of transport. Please don't count on a non-emergent ambulance, as you would likely receive a bill for approximately $600. When choosing a care partner, it's good to have someone with you 24/7 for a few days to a week or so after surgery. Your care partner can be anyone or more than one person. The person can assist you with things like meals, shopping, bathing, and transportation to therapy. If you don't have assistance at home, we can provide you with brochures for private pay agencies who can assist you anywhere from an hour to as many as you need. Most of you may already know where you'll be staying following surgery. The best place for you is to go home, but sometimes that's not possible, and we want you to go somewhere safe. That might be an acute rehab or skilled nursing facility. Acute rehab is like going from a hospital to a hospital. Here in Fresno, we have San Joaquin Valley Rehab, and in Visalia, we have Cahuilla Delta Rehab. If your doctor ordered rehab for you, what he's actually ordering is an evaluation. If you're accepted, your insurance company will still have to give authorization prior to you going there. Skilled rehab is a skilled nursing facility that has beds set up just for your rehab. Your insurance company has to give prior authorization as well. Medicare pays up to 21 days. If you're considering skilled rehab, we are happy to provide you with names of some facilities.
In regards to equipment, if you have a prescription for a front wheel walker, 3-in-1 commode, or toilet seat riser, it's great to get those in advance. Medicare is contracted with only a few vendors and covers the cost of the front wheel walker once every 5 years. However, the 3-in-1 commode and toilet seat risers are not covered by Medicare and most insurance companies. Some physicians may give you a prescription for your equipment at your pre-op appointment. You can take that prescription to any vendor of your choice. If you do not have your equipment when you arrive here, we will order the equipment you need. We may ask one of your family members to pick them up. If your physician ordered a CPM for you, it is always covered while you are here. The only insurance company that does not cover the cost when you go home is Blue Shield. A representative for the CPM will discuss the CPM and the rental agreement with you prior to your discharge home. If you have been given prescriptions for medications, it's a good idea to get those filled before coming in for surgery so that you have your pain meds along with any other meds ordered ready when you go home. If you are one of the few patients who will be using the blood thinner Lovenox, you should turn the prescription into your pharmacy so they can be sure the amount you need is available. We will make sure that your needs are met before you go home. If you have any questions that come up, please feel free to call the hospital and ask for the discharge planning department.